Okay, teacher, and now we'll start with the unit 8 that called Allied Health Professional. Let's do it. Community health. The health of the community depends on a large number of people, other than medical practitioners and nurses. These can be a group under the heading of a allied health professional. They include the following: physiotherapists, officials, help to people to move by getting them to do exercise or by treating their body with head or massage. Treatment by manipulating muscles and joints with the hands. Occupational therapists or OTC help people with a disability to perform tasks at home and at work, and eye disability is a physical or mental condition that makes it difficult to live. Normally, for example, blindness or deafness. Social workers help people to solve their social problems, for example, poor housing or unemployed or family problems. Chiropractics, also known as polytrolics, treat conditional affecting the feet. B. Technicians. There are numerous technician people who work with specialized equipment such as radio, radiographs, who are works and X-ray technician, ambulance technicians, work in the emergency medicine service, and ambulance technician with more advanced qualification is called a paramedic. C. Prosthetics are orthotics. Prosthetic or an orthotics provide care for anyone who needs an artificial limbs or a prosthetics or a device to support or control part of the body. They also advise on rehabilitation, helping patients to return to a normal life and work after treatment. Prosthetic provide artificial replacement for patients who had an amputation or were born without a limb. Orthetics provide a range or splints and other devices to aid prevent current deformity from an abnormal development or part of the body, for example, club foot and tap lips and relief pain. Optician. Opticians test eyesight and describe glasses, also known as spectacle and contact lens. When necessary, the examinations include measuring intraocular pressure, the pressure of fluid inside the eye, and examining the retina if the optician suspect an eye disease such as a glaucoma. They refer a patient to their GP for the treatment. The GP may then refer the patient to a ophthalmologist, a doctor who specializes in disease of the eyes. Okay, let's continue with the exercise right now of Unit A. Okay, let me see. Okay, perfect. Let's do it. Okay, make word combination using a word from each box. Look at B, A, B, C, and D opposite to help you. Ambulance technician, artificial limbs, club foot, contact lens, health professional, intraocular pressure, occupational therapist, and social worker. This is the number one. Let's go with the number two. Which allied health professional could be help the following people. Look at A, B, C, and D opposite to help you. A. One, sorry, a young unmarried woman who has just had a baby, social worker. Two, a woman who has having difficulty using her right arm following a fracture, occupational therapist. 3. Someone who needs glasses, optician. 4. An elderly woman who has had a below knee amputation, prosthetics. 5. A man whose wife has Alzheimer's disease, social worker. And 7. A man with a fungal infection of his feet, chiropodist on podiatrics. Number 3. Complete the test, look at A and C opposite to help you. A prosthetic work with patients of all ages as a member of a clinical team based on a large hospital. The patients may need to prosthetic as the result of an accident or amputation following disease such as diabetes. Alternatively, they may have been born without a limb or prosthetics work alongside doctors, nurses, physiotherapists, and occupation therapists to give the people under their care the best possibility care. Their main aim is to enable the patient to live a normal life at work and leisure. An orthotist often works in a clinic as a part of a occupation service and also visit other centers to provide a service for people with special needs. They deal with people of all age, for instance, children who have cerebral palsy may require a splint to help them walk, and many other peoples need specialized shoes to correct deformities. If damage any part of the human skeleton may require some form of orthosis. The orthosis may be needed to reposition the body or to relieve pain. Okay, thank you so much. Let's continue with the unit 9. Okay, teacher, this is the unit number 9 that called hospital. Let's start. Introduction to a hospital. Jordi Pons is a 4 year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Barron, introducing him to the hospital. Dr. Barron, the Royal Infirmary is the name of the University Hospital for Edinburgh. University it is a general hospital dealing with a types of patient and issues except pediatrician. We have a specialized hospital for that in other parts of Edinburgh. The hospital for sick children. You can see some of the department is our hospital on the signs. Of course, there are many others. For example, the intensive care unit or ACU and the surgical high department unit HDU. Jordi, what does outpatient means? Dr. Barron. Outpatients are the people who come to hospital to attend a clinic or to have tests or treatment and then return to home on the same day. Inpatients stay in the hospital for 1 or more days. The rooms where they stay are called wards. Inpatient treatment require only one day, such as a simple operation. They can be admitted to the day surgery unit. Outpatient. Dr. Barron. The accident and emergency department, A&E, also called casualty, is where patients who are acutely ill with a certain serious condition come for assessment or treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient department. or OPDC, they have usually been referred to the hospital by their GP, who writes a referral letter to be consultant explaining the patient problems. Inpatients. Dr. Baron. The inpatients in hospital are admitted in one of the three main wards. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need, as in the case of hip replacement, they are put on a waiting list for admissions. Alternatively, their GP may arrange the admission by telephone because they are acutely ill. For example, which suspect myocardial infections, or they are seen in the A&E department where the doctors on duty working at the time arrange the admission. This would happen in the case of a patient with a fractures neck or femur. For example, large hospital may have an assignment unit where patient can be admitted temporarily while the conditional is assessed. Jordi, assessed. Dr. Baron, yes, decisions are made about their condition and what needs to be done to help them. After treatment is completed, the patient is discharged back to the GPC care. Okay, let's continue with the exercise right now. Let's see. Okay. The first one. Complete the table which word from A, B, and C opposite. Put a trace mark in front of the traces syllably in each word. The first one has been done for you. Okay. Admission. Access, assessment, discharge, operate, operation, referral, treatment. Number 2. Make word combination using a word from each box. Look at C opposite to help you. Acutely ill, assignment unit, on duty, federal referral letter, and waiting list. Number 3. Which hospital demands will be most appropriate for the following patients? Look at A, B, and C opposite to help you. 1. A woman in diabetic coma accident and emergency. 2. A patient who have just had a radical prostatectomy surgical warrant. 3. A patient who is to have a skin lesion removed, dairy surgery unit. 3. A patient who is to have a skin lesion removed, day surgery unit. 4. A man with for her body in his eyes casualty, ANI. 5. A woman with a treated abortion, maternity emergency. Complete the extract form and information leaflet for patients. Look at A, B, and C opposite to help you. Information for our patients. When you arrive at the outpatient department, please tell the receptionist, who will become you check for details and direct you to the waiting area. The length of your visit will depend on the clinics you are going to have. You may need to have some investigations such as an X-ray, which could mean going to another department, or you may refer it to other professional such as a therapy, physiotherapy, or dietitian. You may need revisit the clinic staff at the clinic wants to see you again. Another appointment will be arranged for you if you need to be admitted to the hospital. More treatment either as an inpatient or for day surgery. You will be told when this is likely to happen. If you do not need full treatment, you will be discharged to GPC cares. And this is all about the Unit 9. Let's continue with the Unit 10. Okay, teacher, let's start with the Unit 10 that called Primary Care. The National Health Service. The National Health Service is responsible to help care for anyone in the UK. Although a small number choose to pay for private care, treatment is free, but there is a prescription share for drugs and appliances such as a cervical collar, which examinations for some patients such as children and the elderly. Primary care provided by general practitioner or GPC, sometimes known as family doctors, nurse, patients, pharmacists, and opticians. GPC works in practice of 1 to 20. Practitioners are versed in surgery, look after the health of from 1,000 to 50,000 people in their local community. They also provide health education in areas such as smoking and diet, run clinic, give vaccination, for example, for influenza, and may perform minor surgery such as removal of worms, a mole. If a patient needs specialized care, the GP will make a referral, refer the patient to a consult in secondary care. Patients are normally seen on appointment basis. Home visits are made when patients are housebound, unable to leave their home, or too ill to attend surgery or of hour treatment from say 6 p.m. to 8 p.m. improved by the local primary care trust, which organize shift of GPS and locum GPS to cover if someone in someone absence. The practitioner team. A typical GP practice employing receptionists, they are responsible for initial patient contact, making appointment, taking rescue for repeat prescription, taking message from patients and other healthcare provider, and for the filling of scanning documents into the patient's record. The practice manager the responsibility for finance and sometimes for it. Surveys reception staff, hires locum, and help prepare the practice development plan. Practice nurse from admin, diabetes, and cardiovascular disease clinics, as well as one-up-to-one clinics for those who wish to give up smoking. In addition to practice staff, GPS work with a number of health professionals. For example, district nurse visit temporarily a housebound patient, such as recently discharged hospital patient, to share dressings such as also dressings. Sorry. Number two, health visitors visit families to carry out checkups on young children, particularly under 5, to make as such they are healthy. Special attention is paid to families is needed, such as those living apart. They also do babies immunization. Midwife run clinics for attending patients. Practitioner rapids provide hands-on treatment, but also teach teach a patients exercise they can do to improve their condition after an accident or operation. A GPS day. Dr. Stewart works in a practice in a small market town with three of their family doctors. The surgery is in the center of the town and is shared by three practices. This is a typical working morning. When she is not on duty, doctors responsible for emergency and other problems. Okay, let's continue with the exercise. Okay, let's do it. Okay, number one, complete the sentence. Look at A opposite to help you. Number one, children over 60s and people with some chronic disease do not have to pay prescription charge in the UK. Two, patients with mobility problems may be unable to go out. There are housebound. 3. The average GP appointment is 10 minutes long. 4. A locum is someone who takes the place of a staff member who is on leave. Number 5. Care outside working hours is known as out of hours treatment. Number 2. Make word combination using a word of phrase from each box. One word can be used twice. Look at A and B opposite to help you. Okay, chair, charge dressing, make appointment, perform minor surgery, refer a patient, run a clinic, supervisor staff, take message, take home visitor. Which member of practice teams, number 3, sorry, which member of a practice team will be responsible for the following? Look at B opposite to help you. Number 1, running a clinic for pregnant woman midwife. 2, teaching a patient how to straighten his broken leg, physiotherapy. 3, letting the GP know that a patient can come to her appointment, receptionist. Running a clinic for people who want to lose weight, practices nurse. 5. Visiting a patient who has just returned home after a hernia operation, district nurse. 6. Carrying out checkups on children in a poor neighborhood, health visitor. 7. Organizing cover for an Asian doctor's practice manager. Okay, the number 4 is complete the diary for the doctor stuff afternoon. Look at A and C opposite to help you. 1 to 2 p.m. practice team meeting over sandwich lunch. 2 to 4 p.m. afternoon surgery to 12:10 minutes appointment. 4 to 4:20 p.m. coffee break. To 4:20 to 5 p.m. to 5 p.m. check which receptionist for a message, deal which home visited and repeat prescription rescues. 5 to 6 p.m. paper worker referral to secondary care at mistake telephone call to patients primary medical examination. And 6 p.m. phone switched to out hour service. Okay, this is all from Unit 10. Let's continue with Unit 11.